Yeah, welcome everyone. It's time for GW4W's Wine and Tea Wednesdays, and we hope you have a beverage and can relax a little bit. And Shelly Chopra sends her regards. She's not able to join us today, but we are really excited to have Jessica Grossmeier here as our guest. And I think that some of you probably already know Jessica if you're in the workplace wellness world. But for those that don't, she is the VP of Research for Hero Health. She's a researcher extraordinaire, as anybody who knows her can attest. She is the associate reviewer for the American Journal of Health Promotion. She's the former CEO of Verity Analytics and the former VP of Research for Staywell. Again, she is also a GW4W member and serves on our board. And we were delighted to have her author the GW4W 2019 Think Tank White Paper. If you haven't seen that, we highly recommend you download it. It's a great read about what gender equity is and some of the deeper questions that we have to dig into to start to solve for this. So we are so pleased that you're with us, Jessica. Thank you for coming.
Yeah, thank you for inviting me.
Wonderful. Well, we're going to dive right in here, and we know that you've got extensive experience in the workplace wellness world, and there are clearly things going on, but there were things that were shifting even before we headed into this pandemic. So what are some of the major shifts that you've seen over the course of your career that you think companies should be aware of?
Yeah, so thanks so much for that question, Mim. And I could speak to a lot of shifts because there have been a lot of changes in the past few decades. And I'm going to start with sort of a longer term view of how have things shifted in a macro level over the past few decades. But we could have a whole nother conversation about how things have shifted this year because it's been a crazy year. One of the big shifts, there's three I'll mention. One is broadening the scope of health and well-being and what that means. Now, we have known for decades, if you go back to the National Wellness Institute and their original wellness model back in like the 70s.
I think it was 78 or 9. Yeah.
Yeah. Their wellness wheel, it had all the elements: social, spiritual well-being, occupational, intellectual, emotional, physical. It was all there, right? And there are other wellness models that you can look at. World Health Organization and NIOSH has a model. Everyone's got a model and they all have all these elements, right? But employers have focused most in the workplace well-being area on physical health, and then mental health, you get into stress, anxiety, depression, right? And that's sort of where the focus has been. And now we're starting to see, I think in the last 5 years, a pretty significant shift towards understanding, okay, we've got to broaden this out and actually offer more. And it's not that they didn't always understand. Some didn't, but it wasn't that employers didn't understand that they needed to approach the whole person and that that's what wellness was about. I think it was more about what was available for
Right.
employers to offer, right? You need good models. And so now we're seeing things like financial well-being resources being provided, and we're seeing things to address social isolation and loneliness, whole initiatives around that. And so now employers have more tools. And I think that that's really helped us to see the reality of these broader models come to life. And it's been extremely exciting for the past 5 years to see that happen. We've also known for decades, maybe even longer than decades, that you can't just ask the individual to do all the work, right? So it's all about offering all these individual programs, and we offer all this stuff. Why isn't anybody participating? Employers understand, and I think they have understood, if you look at like theory and research, that you've got to be looking at multiple levels. What are you doing with the environment around you? How are you addressing the system? And we've been talking a lot at Hero about how do we address systems for the past 5 years. We're now seeing more and more that employers are doing this. And I think about examples like Stanford. We've published one of their case studies on what they've been doing, and they had this whole model of professional fulfillment and resilience, and all the wellness stuff was right there. But then they had a whole nother segment of the wheel that they focused on efficiency of practice. And they said, how can people be professionally fulfilled when they're not doing what they were trained to do? They're stuck in the mire of these processes that make their work hard to do. How can we change processes and make their work more efficient? So we're getting physicians in particular, in this case, back to what they want to be doing, which is caring for people, and not stuck in the mire of some of this systems, or the broader process stuff. So I think organizations are really starting to address, how do we get past individualistic approaches and augment that with systems approaches. And we I think we've done this best in the workplace wellness world through policy and through the built environment. So we know that there's a whole, I know you had Lee Stringer on a few weeks ago, and she talks about the built environment and building the workplace to be to support health and well-being. Whether you participate in a program or not, everyone benefits, right? And I think employers are now starting to think beyond just policy and just the physical built environment. They're saying, well, what about how work gets done?
Huge issue.
How do we address how work gets done and how we relate to each other? And that's where the whole diversity, equity, and inclusion piece comes in. If people don't feel valued, included, like they belong at work, how can we expect them to have health and well-being? No amount of resiliency programming is going to help if you feel like your manager doesn't value what you do.
Right.
So I think we're starting to really gain some traction in terms of putting this knowledge into practice more. And we're starting to see research test these ideas of, well, does it work if we do it this way? Does it work if we do it this way? Because the how is still the big question, right? And how do you address this? And I think the third major theme I'm going to see is data. Now, as a researcher, I get all excited about data. When I started in this field, I was not a researcher. I was a true dyed to the wool, like, practitioner of health and well-being. I was teaching group exercise classes and doing screenings and the whole 9 yards. I switched over to research because I realized we weren't measuring what we were doing. How did we know what we were doing was effective? And so I went back to school, got my master's, got my PhD, learned about all these great theories, and said, let's start using research to inform what we're doing and then test to see if what we're doing actually creates results. And over the 25 plus years I've been doing this, I'm seeing a lot more employers now saying, well, how do we measure what we're doing? And as we look at systems approaches, as we look at broadening the programming that we're doing to address things like loneliness and isolation, you've got to have the measures to line up with that. Otherwise, how do you know if what you're doing is working, right? So those are three big shifts that I've seen.
And I think it's great. You touched on it without actually saying the word, but it's like the work culture, because all of these things play into how work is changing. And obviously so much of that is accelerated right now because this, work from home for some organizations was like, well, we're not really sure if we're going to do this. Well, here we are. We don't have much of a choice, right? So the grand experiment. But it's also a huge shift then in terms of like, how do we keep those people healthy and connected? And to your point, connected to their sense of purpose and the mission of the overall organization. And so I love that our whole industry, this whole industry around workplace wellness has really shifted and I think been called out around the data piece. The nice to have, the fluffy stuff kind of treated as this thing off to the side, where the truth is organizations spend money and time on this, like they do for any other initiative. And almost all of those have key performance indicators built into, their project plans around whatever it is, protecting data. And so it's really good that now organizations are starting to say, if we're going to invest in this, what is the outcome? And, what are the goals that we're really shooting for? And are we actually meeting them? And I just have to ask this as a side question, because I know we've talked about this in the past, but just the evolution of providers, programming, technology. Like there were a few players like 25 years ago, but the industry has exploded from that perspective. And are you seeing more of those players out there, the quality ones? Like, how are they using their data that, because I know you touch a lot of that through Hero Health. And what's your thought on that?
It's so funny because in this industry, you can know somebody and you can trace like the 6 different hats you've seen them wear.
Yes.
because organizations, they're constantly reconfiguring themselves, right? They'll buy one another, they'll partner, they'll spin another one off. It's this constant churn, which I personally think is extremely exciting. I love change. I'm one of those people that if things settle too much, I got to stir things up because I don't like stagnancy. I like change and that dynamic energy. I think one of the biggest things that we're seeing is we're seeing a lot of organizations that have their expertise outside of health and well-being entering the space and saying, there's something here. But we think we can bring a piece. And when I think about that, I think about employee engagement, right? And not just participation engagement, but employee engagement with their work. We're seeing a lot of organizations that are saying, we think we kind of figured this out and we know how to make our stuff sticky. How can we bring that into health and well-being so that the stuff that's offered feels like it's sticky? It's something that employees want. It's something they're pulling towards them instead of this old model of push, communicate, and maybe some of this stuff will get picked up. It's probably one of the biggest frustrations that I see amongst employers that are really doing this well. They've got all this stuff that they're offering, and when push comes to shove and people need the resources, they don't even know where to turn. They don't even know that they've got an EAP that they can call when they're being relocated. They don't even know that you can call EAP to talk about relocation and the stress associated with that.
And there are leaders that don't even know what an EAP is.
Well, don't even get us started
and honestly,
on that.
I can attest to that because I've been on stage at conferences and asked that question of leaders, and you see blank faces. And I think you're right. I mean, there's such opportunity. Like, what are you already paying for that is different parts of your total rewards program that's underutilized? Where are your strengths? And I think that's the other thing, that a lot of these programs, when they look at things, they're looking at weaknesses and they're looking at, the gaps, as opposed to maybe starting from a place of strength, which kind of leads me into my next question. And again, I know you've seen all these companies out there, but the ones that really have done a good job around this and have a more engaged workforce, what are some of the core values that you see consistently across those companies?
So I can't help but mention a study that we did earlier this year, which is just so affirming to everything I've been studying over the past 10 years in particular. So the study that we just published, A Hero, looked at the Hero Scorecard, which is a free resource that any organization can use. It's an educational inventory to see what are the recommended practices that employers should be using if they want to use an evidence-based approach. And that's the sandbox I get to play in all day. So we took all of this data and we said, which of these practices are actually the most predictive of all these different outcomes that we looked at? So we looked at participation in different components. We looked at health impact. We looked at medical cost impact, and we looked at employee perceptions of support from their organization in terms of health and well-being. All those outcomes. And we said, which ones bubble to the top? And can you guess what it is? The culture of health.
Drum roll.
These practices that we lumped together into this factor that we called organizational and leadership support. And of that cluster of practices, two that really rose to the top were that senior leaders saw the connection between workforce health and well-being and business results. And the organizations that said, yes, my leaders really get this connection. They know that if we take care of employees, they're going to take care of business. That was probably one of the highest predictors of outcomes. And then the other was around how does the organization communicate about those values? How do they walk the talk and let people know that that's really what's going on? And when I think about organizations that do that well, so what does that look like, right? What does that look like when an organization does that? And I think of Intermountain Healthcare. They're a health system, they're a health plan, there are a lot of different things. But one of the things that they realize, so their North Star is patient care, right? Let's make sure that we're providing, the triple aim, high quality care, affordable cost, and, the patient feels like they got something of value, patient satisfaction. And what they realized is, if our employees aren't taken care of, they can't, it doesn't matter what position you're in, a doctor, a nurse, an orderly, facilities management, doesn't matter. If we're not taking care of them, they're not going to bring their best selves to the workplace. And that's going to translate into errors and lower quality and, all sorts of things. And so they actually rewrote their entire mission statement as an organization. And they said to their employees, our North Star is still patient quality and care and the triple aim. the way we're going to get there is by investing in you, our people. And one of the things that I love about them, now this was when I talked with them a few years ago, I don't know if things have changed, but we published a case study on this. And one of the things that they did is they didn't create a department whose responsibility it was to carry out that mission. They said, oh, no. All of my business leaders, this is everybody's job. And so they have a cross-matrixed responsibility and a cross-matrixed budget. And they said, nobody's getting new budget. You're not getting new staffing. Everybody needs to work together at all levels of leadership to elevate this goal of how do we take care of our people so that they can take care of our North Star, triple aim. So that's just one of the inspiring examples. I think another one, when I think about gender equity, which, is our theme, right?
Yes, it is.
When I think about gender equity, I think about REI, who topped this year's best business for women.
Yeah.
And they have said for the longest time, we prioritize our people over profit. We know if we take care of people, the profits will come. And they remain committed to promoting diversity, equity, and inclusion in their workplace. Last year, women made up 38% of its board of directors, half of its senior leadership team, 44% of retail leadership, 45% of its overall workforce. So they've got the numbers to show it. And they've got this other initiative called Force of Nature, which they launched about 3 years ago. And they've invested $1 million into organizations that create opportunities to connect women to nature. So it's a direct initiative to promote women's well-being.
Yeah.
So it's not just lip service.
Right. And that's what we have to call out. And again, I just want to raise up Nest UK, which we honored in London. They have measurable numbers and they publicly put those out there. We were at the Breakers. The Breakers went through, they're working on their D&I, but from a gender perspective. And again, that's there's a little bit about that in the white paper, and different industries. And then I would also like to talk, just to raise up Meteor Education, which is a design firm, smaller organization, multiple offices across the country, but they had one woman on their C-suite. And after working with them and doing, it was also the health and well-being side too, but within 2.5 years, 60% of their C-suite was now female leaders, which was reflective of the demographics in their organization. And, but that doesn't happen without leadership. That doesn't happen without the top leaders. As you pointed out, there is a real benefit to your corporate bottom line if you do this intentionally. And at least the leaders that I've seen that have taken this on understand that it's important for them personally, not you go over there and do this, but they really take the reins on inspiring people to make this change, but then making sure that it does actually go down through the entire organization. So it's really inspiring to hear that it's not just one, not just two, but there are some really great models out there in different industries that we can look to, to start to make this change. Again, we're in these unprecedented times, and a lot of these issues we've been working on obviously for years and years. But from a gender perspective, I mean, one of the things that we really want to raise up is the gender disparity right now in the workplace, particularly for caregivers. And we know, unfortunately, that the majority of working caregivers are women, the ones that are the primary caregiver. And this is a huge issue that we know organizations are grappling with, but women are leaving the workplace in droves. And I don't think I've heard anybody have like an answer, like a really good long-term answer, but would just like to hear like what you've heard on your side. Because again, you talk to a lot of different industries. And I think it's important for people to understand it's not, just in hospitality or just in frontline workers in hospitals, but kind of across.
Yeah, ma'am, we've talked a little bit about how does this stuff connect to the business outcome. Employers who figure this out, they're the ones who are going to thrive, right? Is when they really figure this out. And so what can employers do to address caregiving needs is the question. Right. And, one terrific example that I'm following is Arizona Department of Health Services. So, kind of your traditional public health department. They launched an Infants at Work program. So any parent, dad or mom, it's not gender specific, they can bring their infant up to 6 months of age to work with them. And it's not drop them off in the on-site daycare on the way in, it's bring them to work with them. And, they have a picture on their website where they talk about this program, and, there's somebody standing there with babe in arm having a business conversation in the hallway with somebody or in an office. So I think, that's one thing. And people, when this first came up, they're like, that's a terrible idea. Like, I can't imagine that working. So the rationale was they decided to do this because they said this is more time for babies to bond with their caregiver. It increases the outcome of breastfeeding going longer, which has benefits for both the baby and the mom. It boosts employee morale, and it brings working moms back to the workforce earlier, as well as actually brings them back, period, if
Right.
they know that they've got this support. And that's been going on since 2017. And their initial pilot was so successful that the governor announced the next year, we're expanding this program. We're offering it to more departments. And they have done it. They've actually expanded this program. Now I'm hearing an organization called Texas Department of Transportation, the Texas DOT, they're picking this up, and they just started with their infants at work. So these are examples of employers who are saying, you know what, it might sound crazy, but we think there's a business case for this. Let's pilot it and see how it goes. Let's work the kinks out of it and see how we can make this happen. And some of the anecdotal reports are, yes, we're seeing mothers come back to work in higher percents, and they're coming back to work sooner. And the workplace is just happier. Like, the other coworkers like it too. They're actually enjoying meeting other people's children. So I think that was just something that really warmed my heart. Other things, obviously increased flexibility with scheduling. Organizations have been doing that. Job share opportunities, especially job share in leadership. Why do we not have more co-CEO models?
Yeah, I still don't. I mean, it's funny. I reference the movie 9 to 5 all the time, but because 1980, that's when that movie came out. So now I'm really dating myself. But as a young girl seeing this movie, and they talk about job sharing in that film, that's 40 years ago. And yet at least in my career, I've seen very little discussion about it, or even understanding the benefits of doing it. But I think that, one of the things that one of our members brought up, who she was a former chief talent officer for Tory Burch. And so we were talking to her a little bit about this. And, one of the things that she's recommending is, at least right now, until we figure all of this out, I mean, it's not just having the babies, it's the kids that have to be online at school, at home, and everything else. And it's just becoming overwhelming. So her suggestion is really thinking about reducing hours, but not cutting benefits in the short term, so that you can keep your talent as you're starting to figure this out, without, them having to make an either job or children choice. And there's probably not enough conversation around caregivers that are taking care of older members of their family, which is a whole nother, issue. And I mean, there's some really interesting models, that have been out there for a while, but usually with the bigger organizations, backup elder care service, and, some of those things. So I think there's, crisis, there's always room for opportunity and innovation. So if anybody's out there that's heard some really good models, we're all ears. We'd love to hear more about that.
I actually heard another one just this week, Jackson Healthcare. So they're a healthcare services provider that actually provides staffing for health systems. And they had an on-site childcare center for their headquarters location, as well as an on-site medical clinic. Interesting thing, during COVID, everybody was forced to work, they were moved to work from home due to ordinances and whatnot. They kept the on-site clinic open for non-COVID care, so that their employees could come in and not be delaying critical chronic condition management types of visits because they were afraid to go to their docs because of COVID. So they actually kept their center open for non-COVID care. They closed the child care center that they had on site, but then they deployed the teachers in the child care center and said, who's got our highest call volumes? Let's send those teachers to the homes, and they're providing in-home child care.
Wow.
Where they know they've got the highest volume of calls coming in during peak hours, so that the people who are working from home can actually focus and be able to do their job well, which is patient care. you
Right.
know? So, we are talking about lives matter here, and how do we help employees to do that
100%.
well?
Right. And you think about all the frontline workers, and
Right.
if some of these ideas couldn't now be implemented, because we don't know where we're going over the next 6 to 12 months. We know that there are numbers that are rising here, and there are, more people going, now we're going to work from home through July, or, whatever it is. But there's also that whole other percentage of workers out there that don't have that option.
Right.
And so I think that some of these ideas, I'm hoping that leaders out there think about this and think about some creative ways that they can support their employees. Because we don't know what's going to happen. But again, I just think there's opportunity for us now to shake it up a bit and say, okay, what do we want this to look like going forward? How does this bleed over into closing the gender gap, but also diversity and inclusion, and how it impacts some of those communities. And I think you're 100% right that the leaders that take this seriously as they're working through these changes, and the next normal and the next normal and the next normal, which I think we're going to see for a while, are going to have the opportunity to stay viable in a way that companies that are unfortunately, there are those that are sticking their heads in the sand. So I think it's just great to be able to share some of those inspiring stories and say, yes, you can. There's some great things out there. So as we look towards this next 6 months, I mean, I think that, the biggest thing is, how do I keep my people from burning out? What does it mean to keep them resilient and protect their health? From your perspective, Hero's perspective, and everything that you've seen, what are some of the things that you would suggest?
So I know we don't have a ton of time left. And so I'm going to, preface my remarks by referring people to this great resource. So it is National World Mental Health Month, right?
Yes, it is.
And a lot of organizations are paying attention to, well, what can we be doing? And so Hero just happened to be working on this white paper that identifies what are the best practices around addressing employee mental and emotional well-being. And so what they did is they partnered with a bunch of different organizations that work in the mental and emotional well-being space, and identified case studies of organizations who really are taking a comprehensive approach to things like, how do you address stigma? How do you provide resources, policies, supports for mental and emotional well-being? And so all of the case studies were analyzed. They did a content analysis, and they identified, here are the key themes that employers are using. So that's a free on the Hero website. You go to hero-health.org, go to our resources section. So that's available, and you can see all these great examples of what employers are doing. But, I think one of the things, we're seeing a lot of mindfulness meditation. J&J today is trying to break the world record for the most hours of meditation across an organization. I got a call today. They're halfway through. They're like, we're heading to the West Coast.
Dr. Susan Nicholson, because she's, good friends. And
so we'll see by the end of the day if they get the next world record on mindfulness. We're seeing a lot of this stuff, and it's good stuff, but you've also got to be addressing the system. It's not just up to the employee to do what they need to be doing. And so we're starting to see things like supervisory resilience training, helping them to understand, how do I have the conversation that introduces compassion into a performance discussion to help me understand what's really the root cause, if there's a performance issue or something, helping supervisors to understand, how do they manage teams during times like this? It's not about micromanage and let's make sure everybody's doing their work, so make them fill out all these ridiculous forms and paperwork about all the stuff they're doing, which I've heard has been happening. It's more about, well, how do we just help people to feel supported and connected?
How are you feeling today? And it's the question of just honestly asking, how are you feeling today? Like, what's going on in your life? And and again, I think that's for years, I know all of us have been trying to get leadership training programs to take health and well-being training a little bit more seriously in how you train your managers. But I do think it gets into issues around teaching leaders at all levels how to tap into their emotional intelligence, their cultural intelligence, and giving them an opportunity in a safe space as a leader to think through issues like death and dying. that's a real thing right now for many people in many communities. And that's a really hard topic. We don't talk about things like that typically at work,
Yeah.
but it's going to be key to continue to have trust in your organization if you live in an area where some of your employees might have lost 2 or 3 family members.
Or
And
their coworkers, by the way.
exactly. Yeah.
How do you walk into that team call or Zoom in to that team call after the news has broke
Right.
that a team member has died?
Right.
How do you have that conversation?
Yeah.
Like supervisors, leaders at all levels, they need tools to help them understand how to navigate those conversations well. What are the resources they can be offering people? What are the signs that they should be looking for so
Right.
that they can connect people to the resources that exist?
Which is going to be every bit as important as budget projections. Yeah. When I talk about leadership training, right? That there's this opportunity to do this. We could go on for the next half hour, but we are at time. And I just want to thank you so, so much, Jessica, for being with us. We always take a moment to raise a glass and toast to a healthier, more inclusive, and more sustainable future for all of us. So,
I'll drink to that.
And we invite everybody to join us next week. Our guest is going to be Marianne Schnall. Some of you know her as a writer and interviewer. She's appeared in a variety of media outlets and O Magazine and Mary Claire and Time and CNN and Forbes. And what's really interesting to us, of course, is Women's Media Center, and that she is a blogger at the Huffington Post, contributor to the nationally syndicated NPR radio show 51%. The Woman's Perspective. If you haven't heard that, I highly recommend that you check it out. Her most recent book is What Will It Take to Make a Woman President? And it is an extraordinary book. I highly recommend it. But she interviewed all kinds of women from all backgrounds, liberal, conservative, public officials, thought leaders, artists, activists. And so it's going to be a real interesting conversation, and we hope you'll tune in for that one. And if you haven't already, please connect with us through our website, gw4w.org, LinkedIn. We have a YouTube channel with some just great conversations out there. And we also invite you to look for our heart-to-heart conversations. The next one is going to be with our youngest members, and they are 15 to 20. And they are the next generation. So it's really interesting to hear what the world looks like from their perspective and how we as leaders can pave the way for them. As always, if you need support, please know you're not alone. We have a huge network of coaches, mental health professionals, and people that are just willing to listen. And we just want to make sure that everybody is supported. These are crazy times, so we've got to be here for each other. And last but not least, we ask you to remember that great minds sip together. So we will see you next week. Thanks so much for being with us.